Vasectomies are one of the most effective contraceptions that we have. However, it's probably one of the most charged conversations that we've had in society and my friend group. So I'm a medical doctor. I've worked in obstetrics and gynecology for the last 4 years, and I have this conversation with my patients all the time. So my patients are patients who are pregnant, patients who have delivered, and we talk about future contraception, family planning. What does that look like to them? And every now and then, I'll have a patient who tells me that their partner needs to get snipped. And whenever it comes up for other patients and I ask, would your partner consider a vasectomy? She's like, no, they would never go for that. And so I thought it would be important to demystify it. So what exactly is a vasectomy? So a vasectomy is a minor procedure that basically prevents sperm from entering the semen. So what this actually looks like is something called the vas deferens, which is a tube that essentially carries sperm into your semen. And so what happens is that tube is cut and sealed. And so this prevents sperm from entering into the semen. What happens to the semen is that it still gets produced, but it essentially gets reabsorbed into the body naturally. It doesn't cause any harm. And so what this procedure does not interfere with is testosterone, erections, ejaculations, and libido. None of that changes. One of the opinions that come up, and again, very polarizing conversations, is that there's this concern that you might feel like less of a man. I've heard of men who tell me that's absolutely not the case, that they definitely don't feel like less of a man. What this procedure does is effectively interferes with your fertility. It does not change your masculinity in any way, shape, or form. So you're probably asking, how is this done? And so there are two techniques. There is the conventional vasectomy, which is a tiny little incision that happens through the scrotum. It's an outpatient procedure. The tubes are cut and sealed, and it's done within 20 or 30 minutes. The second option is a no scalpel technique. So this is a very small puncture that happens, less bleeding, less invasive, and again, it's done as an outpatient procedure. And for both of these procedures, so most men go home the same day, have a little bit of pain and discomfort for the same day, but usually disappears after a day or two, and are usually back up and about, resumed with daily activities within a week. So let's talk safety. A vasectomy is one of the most effective and safe procedures that we can do. In terms of effectiveness, it's over 99% effective. Studies found that in 1 in 2,000 vasectomies fail, so it's an incredibly effective long-term contraception. And in terms of the risks, they are minimal. So major complications are extremely rare. Minor complications, some pain, bruising, swelling. And so long-term studies show no increased risk of heart disease, cancer, or sexual dysfunction. So globally, 6 to 10% of couples rely on vasectomies as their long-term contraception. Rates are typically higher in countries like New Zealand, UK, and Canada. And lower uptake usually tends to happen where there's cultural stigma or misconceptions around the procedure. So interestingly, long-term relationships, vasectomies are the ones that are most commonly chosen when they know the family is complete. And most men actually report having more security and safety knowing that their risk of unplanned pregnancies is obviously significantly lower. There are benefits and downsides to everything. And so the benefits of the vasectomy is that it's incredibly cost effective. It is permanent. It takes the burden off a female partner of having to manage the contraceptive responsibilities. No hormones and no monthly or daily mental load. The downsides is that it should be considered permanent. Reversibility is possible, but it's definitely not guaranteed. Some men report having regret after the procedure, usually emotionally and not physically. And it does require an honest conversation within a couple. And so my argument, and this is me purely playing devil's advocate, is if you're a woman, would you leave your reproductive future in somebody else's hands? And for a guy, would you trust someone enough to ensure that you don't have an unplanned child? And so neither answer is right or wrong. The important conversation to have is that the burden doesn't necessarily fall on one partner or another, but it's important to have a conversation because sometimes it's about realizing that there is another option. And it's just to start the conversation. So I genuinely am curious if there are any guys or women out there who have a strong opinion around this. I would love to hear your thoughts. Please drop them below in the comments. If you enjoyed this video and you'd like to see more, my latest video is up here and you can always subscribe to my channel.